Good afternoon. I'm Eva Gordon. I'm a licensed social worker and mental health consultant. Today, I want to talk with you about what is mental health and what it looks like, and what tips we can do to really take care of ourselves. So, when it comes to mental health, the first question to ask yourself is, how do I feel? How do I feel emotionally, mentally, physically, and spiritually? And all these thoughts impact our behavior and how we think as well. And they all connect. So, our mental health does influence how we handle stress, how we handle problems, how we interact with others, but also how we make choices. And if we do not check in with our mental health, this could lead to serious mental illness. So, mental health does impact every stage of our life, including um, our childhood, adolescence, and adulthood, including retirement and going into our golden years. Right? So, over our lifespan, we're going to be dealing with all kinds of issues and aspects of, of mental health that will impact our mood, our thinking, and our behavior. So, what are some contributing factors to mental health? Well, one aspect is a biological impact or influence, I should say. Could be a brain chemistry issue or a chemical imbalance that could impact our mental health. Another aspect is our life experiences. A birth of a new baby could impact our mental health, a new job, moving to a new town, or losing a job, death of a loved one, a divorce, or dealing with any other kind of social emotional issue in our lives, especially for children starting a new school or losing a friend or not having any friends can also impact our mental health. Another uh, aspect is our family history. So, did you have a parent growing up that did have depression or did have anxiety issues and they did not get treatment for that? Did you also deal with trauma of child abuse or domestic violence, which also impacts our mental health? But in addition to the family, is the environment that we're living in. So, is your workplace stressful? Is your home life stressful or healthy? In particular, nowadays, when we're dealing with the public health pandemic of COVID-19, we're home a lot more than we usually are. And this can greatly impact our mental health. So all these factors involved is what's the first sign or first thing we do to check in? Well, a few things are one, you're sleeping and eating. Am I sleeping a lot less than usual, a lot more? Can I actually have a full night's sleep and not wake up in the middle of the night and kick it back to sleep? When it comes to eating, is our appetite increasing or decreasing? Are we feeling more anxious than usual? Any kind of nausea going on? And these are signs that something is happening mentally or environmentally that can impact how we feel. When it comes to social interactions, it's also important too. Are we finding ourselves yelling at our kids more than usual? Are we crying more than usual? Are we yelling? Are we getting angry? Our temperament is so important in how we respond to people and situations can be a real sign that something is happening mentally. We have to really address it. It's not easy to deal with these things, but the more we ask ourselves how we're feeling, how we're doing, we can definitely get the help we need. So, what do we do? What are some things we can do to really take care of our mental health, especially at home? Well, I think one thing is definitely to think about crisis is temporary and we are permanent. Even though we are really, really having a hard time dealing with what's happening in the world, be it the COVID-19 impact or race issues or the issues, know that there is a brighter day tomorrow. That's so important. And my theme for that is it's okay not to be okay. That's so important to know that even if we're having an issue, we will be okay and face it. Figure out what works for you. Does working for you mean taking a break, going for a walk? Even if it's cold outside where you live, and it's cold where I live right now too, that we can really go for a 5-10 minute walk, get some fresh air in our lungs, and get some sunshine in this time of our lives. Another thing is also is talking to a friend or journaling, which is very, very important to express how we feel. And if you're working from home, which is definitely hard to do, are you making time to take a break from working from home? Right? Are you going for work? Are you breaking for lunch? Are you drinking more water than usual? Since you're not at your office building, you're still working. But it's so important to really check it and see how we're doing these days. Because when we check it and say, you know what, I need to take a walk. I've been sitting at the computer for the last hour or so. It's time to go for a walk. You know what? My kids are doing virtual school. Let me see how they're doing today. Let me check and see that they're focusing on school, or are they having fun? Are we as a family having fun? Right? So self care is the best care. And the first step in self care is knowing how you're doing, right? And then how those around you doing. That's so important as well. So is everybody in your family sleeping okay, eating okay? Are you doing the same? Are you taking deep breaths when you're stressed out? Are you trying to pause before you respond quickly to a situation? That's very important too. Are we calling people more? But also, are we going to the doctor? You can still go to the doctor and make sure that you're okay. High blood pressure, um, anything of that nature can definitely be important to you. So, what is mental health? It's how we're doing internally. It's also how we respond to the world around us, how we interact with others. How are we making sure that I'm okay, as well as is my dad okay? Is my mom okay? Are my kids okay? Is my husband okay? Is my wife okay? Are my friends okay? As we ask ourselves this question, how we're doing, let's share the same thing with others. So I look forward to working with all of you and giving you more tips about how do we deal with mental health on a really healthy basis. Take care.